All right. Ooh,
Thought at high power this was
what's
good
going
for a
on?
granular cell tumor.
Oh, good. But gosh, that looks like squamous cell carcinoma, doesn't it? So scary. But like you said, there's other stuff in the background. So from low power, this looks classic for granular cell tumor, pale cells filling up the dermis and very helpfully trickling between the collagen. I find that the low power clue, pale cells filling dermis and oozing between and intercalating or trickling between the reticulodermal collagen, looking kind of infiltrative looking, although that name sounds scary, so I don't usually use that, but that's basically what it looks like. But the collagen doesn't seem to mind. There's no like fibrosis or host response here. And this is a very typical characteristic pattern of granular cell tumor is they trickle between collagen. They have the granular cytoplasm because they're filled with phagolysosomes, and these blobs, which people call pustulo-ovoid bodies of Million, and they stain with S100 and CD68 and PAS, which you don't really usually need to do. But the thing to remember is that sometimes, oh, and there, that's nice, look. Perineural involvement. Oh, I thought it was a nerve, I was wrong. But they usually do. If you look around, like almost 90% of them will have a tumor wrapping around nerves. Totally a normal benign finding that is present in the majority of granular cell tumors. Not worrisome at all. All right? So look, the thing here though is how do you explain the epidermis? Is this like a coexistent squame? Okay, if it loads here. What's going on here? I mean, that's not granular cell tumor, is it? There's granular cell tumor in the background, but what's happening with the squamous stuff? So this is pseudoepitheliomatous hyperplasia, reactive epidermal hyperplasia, and granular cell tumors tend to incite this and make the epidermis grow like this, just like we can see over like invasive fungal infections sometimes, or in bromoderma, halogenodermas, right? All these things that mimic squame but are actually benign and reactive. Granular cell tumor is notorious for doing this. I feel like the times you see it most is in mucosal sites, like on the tongue, which is really dangerous because if you call it squamous cell carcinoma on the tongue, someone's going to probably get a hemiglossectomy or something, and then when you find out later, oh, whoops, it's actually granular cell tumor, that's not great. So always, I think it's a good rule, especially in the tongue, if you're a pathologist watching this, you know, you think you see a squame that's kind of bland looking, look in between the islands of keratinocytes and make sure that you don't see any granular cells in there. And if you do, then you got to really think maybe you're dealing with a granular cell tumor and mimicking a squame. And in the skin, you can sometimes see it. So it's this kind of pseudoepitheliomatous hyperplasia. I've also seen a case like on the foot that was mimicking a wart. It looked like a wart, and then on a deeper biopsy, granular cell tumor. So it can make the epidermis grow in weird, strange ways and develop some glassy atypia.